welcome to another video reflection of the migration and health. My name is Andrea, and today the reflection is about social determinants of health, and there are some questions that I want to emphasize in this video, and like questions and answers. This is from an article by Wilkinson RG in 2003 about the social determinants of health, the solid facts, and World Health Organization. So it is invocated to Office of Disease Prevention and Health Promotion, Social Determinants of Health, and it is available in the online. It is available online. So we're gonna start. The first is the main points of the documentary or about the reading. Now, what are the main points? After reading the study facts by Wilkinson and Marmot and the resources from the Office of Disease Prevention and Health Promotion, I understood that the central point in this is that the health is not only determined by biology or medical care, but also by social and economic conditions in which people are born, grow, live, and the age of them. These determinants include education, income, even employment, housing, social support, the family, and the access of healthcare and mental care. It is important to let's emphasize the inequalities in these areas that lead to health disparities, showing that health is deeply connected to social justice. So, was anything unclear or confusing for me? I think one aspect that I found slightly confusing is how to measure relative contribution of each determinant. For example, is income more decisive than education, or does social support outweigh healthcare access? While the readings highlight their interconnectedness, as a medical student, as I am, right, I sometimes wonder how to translate this complexity into clinical practice or health policy interventions, right? I think this is the more confusing for me. And the next one is what was new for me about this, and if there is something that changed my mind. Something that truly changed my way of thinking, for to be honest, was realizing that medicine alone cannot solve health problems if the underlying social factors are ignored, right? Before, I used to believe that better hospitals, include even the medications and the treatments, were the main path to better health, as if we are in another country like our neighbor, United States. Sometimes the people think that everything is better just for to have better treatment. But now I see that preventive strategies addressing housing, education, and equity may have an even larger impact. In Mexico, we used to have the better vaccine program, right? And that is like prevention, right, for the people. And so this perspective shifts my vision of what it means to treat a patient. But in all the areas, the prevention is we don't have that culture, right? The prevention of health for to prevent some diseases like diabetes, hypertension, right? Um, so another question is, was there anything you'd like to explore further or learn more about? I think, yeah, there is something. I would like to deepen my knowledge about how health systems can integrate social determinants into patient care. For instance, how can physicians collaborate with social workers, educators, and policymakers to design holistic interventions? Learning this is important for me, right? Because someday I will be a doctor, maybe I will be the boss of some area of the hospital, and I want to go beyond clinical treatment and contribute to systematic change that improves people quality of life, right? That's that we want like medical students and like a future doctors. We're here for to take care of the people and give at least one a specific example of an aspect of experience in my personal life or my professional life related to the main topic shown in this documentary. And I got one, yeah. And a concrete example from my personal experiences when I did we could call like community service is one activity that in the university it's called clinic mobile, right? And sometimes they do service community the weekends, right? In rural areas. So many patients came to the clinic with preventable conditions like malnutrition, respiratory disease, and uncontrolled hypertension. So, and diabetes too, uncontrolled diabetes. So at first, I thought the main problem was the lack of medication. But after talking with the families, I realized the root causes were poverty, limited access to clean water, poor housing, and lack of education about healthy practices. So they really ignored so much things. And this experience really reflects the importance, of the social determinants of health described in the readings and reinforced my commitment to approach medicine in a broader, more holistic way. So, in conclusion, okay, the readings on the social determinants of health highlight that medicine cannot be limited the diagnosing and treating diseases, but must also address the broader social and economic realities that shape people's well-being. Right, as a medical student, I now understand that the health is not only about individual choices or genetics, like all the time we say, but also about the condition in which people live and grow. I know it's something difficult to understand, but it's the reality of a lot of Mexicans and Mexican people. And this perspective pushes me to view healthcare as a multidisciplinary effort that requires collaboration beyond a clinical setting. So ultimately, the challenge for future physicians like myself is to integrate social awareness into medical practice, ensuring that our role goes beyond curing disease and extends to promoting equity, right? Prevention and justice in health. This is something that I learned when I read this. Is well something that will explosion in my mind. So I think this is my real opinion from my heart and from my brain. That this is the most important. So thank you for listening to the video of this week, and we see us another day with another video reflection. So thank you so much.